Well, thanks for, it's great to see the room still full here at the last afternoon of the meeting. It's been a terrific meeting, and I think you'll be pleased at this next plenary session. It's my real privilege to introduce my friend and colleague, Nancy Brown, who's the Chief Executive Officer of the American Heart Association, a position she's held since 2008. For those of you who don't know much about the American Heart Association, it is the largest voluntary science organization globally devoted to the understanding, the prevention, and the treatment of heart disease. After NIH, it's the largest funder of heart and stroke research in this country. So an important organization for all of us involved in cardiovascular health. In addition to leading the Heart Association, Nancy's also a member of the board of directors of Research America, the Alliance for a Healthier Generation, the Campaign for Tobacco-Free Kids, and the Truth Initiative. She serves as a member of the health governance community of the World Economic Forum and is a past chairman of the board of the National Health Council. Please join me in welcoming the AHA executive, Nancy Brown. Thank you.
Thank you and good afternoon. And thanks especially, Bob, to you and Ashley for inviting me to be here with you today. It's such an honor to be on this fabulous campus, the home of so much innovation, to talk about a topic that's really important to all of us at the American Heart Association. And I want to start by giving you a sense why. You know, for those of you who don't work in cardiovascular diseases specifically, you may or may not be aware of these statistics. But when we think about the leading causes of death in the world, 17.5 million people a year lose their life to cardiovascular diseases. And the cost and the burden and the toll of prevention and treatment of cardiovascular diseases continues to skyrocket. And here in the United States, we actually have just had an alarm bell rung for our own work in the domestic area. And that is that for the first time in decades, death rates from cardiovascular diseases, including stroke, have actually increased instead of decreased. So for almost 40 consecutive years, there was this continued decline down of death rates. And a lot of that was due to fabulous discoveries in new medications and new treatments for patients who were suffering from heart disease or stroke or other vascular diseases. And now with all of the onset of type 2 diabetes and obesity and the things that are causing the level of unhealthfulness in this country, death rates are continuing to rise, especially for those in various ethnic populations. And so this is a real concern to the AHA. The other reason this is a real concern to the AHA is that cardiovascular diseases affect real people. And the promise of big data must help people like my very new friend, Finn. This young boy is 2 years old. And he has already endured 9 heart surgeries. In July, he will be going back into the hospital for 2 more surgeries. And his mother, Brittany, asks really good questions. She wants to know why and how the medical system is going to provide tools and resources for Finn to manage his health for the rest of his life. Who is thinking about creating personal health records for children so that data can be monitored by parents and then ultimately by kids themselves as they grow older? Who's helping to bring together data so that we can learn from these types of stories so that kids like Finn that maybe haven't had as good of an outcome might have it later? And so we keep people like Finn at the front of our minds every single day when we do our work at the American Heart Association. And we also think about people in general and patients in general, because so many people have their life and that's what they focus on, instead of what people have to do, which is to think about managing their health. And when we think about interactions between healthcare providers and patients, when is the last time a doctor or a healthcare provider asked any of you, or for those of you who work directly in that field seeing patients, when's the last time you asked your patient, what is your greatest aspiration and how can I help you meet it? And how can data be more helpful to people in managing their life? And when we think about this era of all of the new technologies that are going to change the way that we do science and think about new outcomes for patients to help, again, reverse those trends of cardiovascular diseases, hopefully in the future, we really think about how these industrial revolutions have impacted our lives and what has to be done to be able to manage that, this new way of working for all of us. So when we think about the industrial revolutions and how they've impacted the world, back in 1784 when mechanical production and steam power energy were first introduced, that was, of course, the first industrial revolution. And it took all the way until 1870 for the second industrial revolution to emerge. And that's when mass production and electrical energy appeared. Imagine living our lives without things being mass produced and without energy. What would that be like? But people who were brilliant, fabulous innovators created these technologies for all of us. The third industrial revolution came along in 1969, and that's when we all began to enjoy things like electronics and the old-fashioned information technology tools. And so here we are in the fourth industrial revolution where artificial intelligence and big data come together in a new way to solve new problems. And what we know about this is that the speed of the current breakthroughs has no historical precedent. And it's wonderful that all of this technology is available and the promise that it can bring for science and medicine. But the question is, how will it be managed in a way that ultimately benefits patients like Finn? The other thing that's happening, as many of you know who see patients and work in the healthcare system, is how much the roles are changing. And, we talk about the role of patients and the public, consumers and patients, pick your words that you might like to use. And people want to be active participants in their health. And that's a really good thing because it provides an opportunity for there to be so much more information and knowledge that can help us create new solutions. And so today I want to talk about 4 things that the American Heart Association is focused on in this fourth industrial revolution to try to do our part in helping to stimulate the system. First, I want to talk about the rise of the empowered consumer. Secondly, redefining traditional doctor visits. Thirdly, the promise of patient-powered research. And the fourth is the importance of data sharing. So when we think about the rise of the empowered consumer, the wearables, which all of us have and use, we call that health is the new black. For those who can afford it, it is. For those of us who can afford expensive wearable devices, we have an opportunity to interact with our health all the time. But the question we have at the American Heart Association really is, where is the evidence base to show that these tools are actually valuable to individuals in improving their health, and that this information can actually be reliable enough to be used in studies? We talk a lot about real-world data, and we are very supportive of creating an environment of data coming from many sources at the AHA, and I'll talk about that in a little bit. But what we're concerned about at the same time is that there needs to be an evidence base to be able to understand and know what works for what people at what time. And so through the American Heart Association Center for Health Technology that Bob is a co-chair of, we're very much focused on trying to create these studies and put this knowledge and information into the marketplace. The second thing is in terms of redefining traditional doctor visits. So when we think about how big data is improving patient care today, we think about improving care coordination, we think about the opportunity to identify and treat high-risk patients, and certainly remote monitoring. And all of these are important aspects of health and well-being that we hope will continue to be integrated into care in all systems in this country and worldwide. But at the same time, we know that there's an opportunity to use this data to really recreate what we know today as the physical exam. With sensing devices, capturing data for people in terms of how they live their lives instead of the moment or encounter when they're in the office can be very, very important. And I assume that Dr. McCrae, who was here yesterday talking about our One Brave Idea research enterprise, also shared the vision that team has, and I see Ewan right there, Ewan you and as part of that team, to really think about how we can completely recreate a digital physical exam, not just measuring the things that we know how to measure today, but figuring out what are the things that need to be measured to better understand this transition from wellness to disease. Could we find a way to create, with all of this technology and data, earlier indicators of when people might be making that transition, so that instead of managing people after they have health problems, that we're helping them before those exist? In terms of patient-powered research, we're very excited about the important role that patients and the public can play in contributing their data and information to research. And I understand that yesterday you heard and learned about All of Us, the NIH's very important, critically exciting new research enterprise enrolling 1 million people in the U.S. population. And we think that's really terrific and look forward to collaborating with that group extensively. At the American Heart Association, we've created My Research Legacy, which is with a goal of really capitalizing upon the amazing connections the American Heart Association has with people in communities throughout the country. In case you didn't know, in addition to the 33,000 science volunteers of the American Heart Association, we have 33.5 million volunteers and supporters in communities throughout America, as well as people who are very loyal and passionate to the AHA in 70 countries where we do business. And so we think it's our opportunity and our obligation to help individuals who are willing to contribute data to have an opportunity to do so to an organization that they know and that they trust. And we're starting, actually, instead of just creating an open forum where anyone can contribute data that they want, we're starting with a pilot study, a proof of concept study, looking at recruiting 2,500 individuals under the age of 50 who've had a heart attack, a stroke, atrial fibrillation, who have had have congestive heart failure or other diseases related to connected tissue disorders. And with these individuals, we are attempting to understand two things. First, what does it mean to someone to know and deliver and contribute their data? What are their expectations from an engagement standpoint on one side? And secondly, how can this data be most valuable to the scientific community broadly in looking and understanding patterns between and among those folks? And so we'll be connecting genetics, lifestyle, and health data all in a secure portal that will allow individuals, as I mentioned earlier, to interact with their health and their health data. We also hope that My Research Legacy in its ultimate format, where we hope to recruit in the next several years 250,000 people who will be willing to contribute data, can also fill a gap of needed information that helps organizations like the AHA set really important goals. For example, imagine if we could get lots of people to contribute information on their dietary patterns, information on their physical activity patterns through wearable devices, if we can be sure we know which ones are reliable and can submit information in the right way. This data now, when organizations like ours want to measure impact, or even when this country wants to be able to declare the status of tobacco use or physical activity, the sample sizes for databases like NHANES, which are meticulously developed and managed, are actually very small when you're concerned about looking at subpopulations. And we at the AHA are very concerned about looking at subpopulations. And so we hope that My Research Legacy can be a way that we can contribute most broadly. We also have been very focused at the AHA on trying to propel the topic of data sharing. And I was really intrigued by our colleagues from that were in the session immediately prior to lunch talking about data sharing and what the obstacles are and what the possibilities are. You know, we've seen these for a number of years at the AHA. As Bob mentioned, we're the second largest funder of cardiovascular research in this country after the NIH. And we've had an open data policy for a number of years, but we see the things that get in the way. And so as we created our Institute for Precision Cardiovascular Medicine at the American Heart Association, one of the premier strategies of the Institute was to create a data sharing platform where we hoped that we could use the good name and goodwill of the American Heart Association to encourage people to share data in a secure cloud environment. Think about it as a cloud of clouds. So the data sources keep their information in a cloud, and the AHA has created this cloud cloud of clouds. And we've been able to do that. We've created with Amazon a precision medicine platform. This precision medicine platform is now up and running. We're gathering consumer-generated data through my research legacy, omics data, social and environmental data, genomic data, clinical trial data, EHR data, registry data, and population study data. And again, in this cloud of cloud formats, people will be able to contribute data sets that will be searchable across and among a wide number of data sets. And we have secure sandboxes. As you can imagine, Amazon has been just spectacular in helping us to create a set of analytics and tools that will be very useful for scientists and researchers, while the original data sources are protected, of course, at all costs. When we think about our early data partners, I'm very pleased to be standing here at Stanford today because Joe Wu was one of the first to offer up data from the Stanford Cardiovascular Institute. Some of the stem cell data will be available on the data discovery platform, as well as data from this sampling of studies and organizations. There are many more that have made commitments, and we're onboarding them right now. We really think that this data discovery platform will be a game changer in terms of the way research is done. If we can cut down the time it takes to access critical data and provide people with new tools and analytics, we think it will make a major difference in science and research. And to fuel this, the HA is putting its own money with Amazon behind inspiring use of the platform and inspiring the field of data science. The HA and Amazon have pooled together about $6 million in resources that we are giving out in a competitive grant environment. If you've not been on the American Heart Association's website lately for research grants, please take a look. I'm glad to announce that Mintu actually was the recipient of one of these data awards most recently. So we'll be launching awards in data mining, methods validation, innovative development awards. We'll be giving data fellowship awards, awards for new patterns in data, and then some awards that are funded by Bayer in the area of discovery. These are on top of other grants and awards that our Institute for Precision Cardiovascular Medicine is giving to help identify and deepen information in the phenotypic area, as well as the exposome interaction with the phenotype and genotype information. And so the HA is so committed to the field of precision medicine, we've committed our own $30 million to launch the Institute and have been busy at work creating things like the My Research Legacy and this data discovery platform, and the One Brave Idea research enterprise that the HA, Verily, and AstraZeneca have funded for $75 million. We know that for big data to be able to be used in a way that is truly meaningful, we have to get at the core of the issues that will hold us back. You know, if you're a healthcare provider today, these are the kinds of questions that we're hearing. You know, are EHRs helping or hurting? Are patient-facing digital tools useful for my patients? And if so, which ones? What will provide better care and more efficient care and allow for more time for a physician-patient interaction? And if you're a patient, you're asking questions like, what does all of this data mean? Am I healthier because I'm tracking my steps and monitoring my food intake? What digital health solutions work? What's meaningful? What should I use? How do I share this information with my provider? Does he or she even care? Does it help? You know, these are real questions that are being asked today. And so when we think about the speed of new technologies coming into the marketplace, we have to pause, or at least concurrently, make sure that we're working on answers to these questions so that we can get the biggest uplift possible. The other thing, when we think about the convergence of data and all of the opportunities and challenges, I've mentioned to you previously that we're working with all of this data at the HA: physical data, consumer-generated data, clinical trial, EHR, environmental data, and registry data. We're doing it in our Institute for Precision Medicine. We're doing it in One Brave Idea. And we know that there's so many opportunities that come with these data sets coming together. The 360-degree view of the patients, new discoveries, new therapies, new models for prevention and improved care coordination, all critically important things. At the same time, there's challenges that come about data sharing, data integration, privacy, computational infrastructure, and analytics capabilities. So we have to devote time to answer these questions and to make sure that we're investing in the challenges as much as we're investing in the opportunities. So I want to come back to the fourth industrial revolution for a moment to tell you that there is an organization that's very focused on the infrastructure for all of the new technologies. And at the American Heart Association, we're really honored to be a part of the World Economic Forum. And its founder, Professor Klaus Schwab, has said the following about the fourth industrial revolution. The fourth industrial revolution can compromise humanity's traditional sources of meaning, work, community, family, and identity, or it can lift humanity into new collective and moral consciousness based on a sense of shared destiny. The choice is ours. And because the World Economic Forum believes so strongly in this, they've actually created, and it was opened just 2 months ago, the Center for the Fourth Industrial Revolution, right here in the Silicon Valley. This Center for the Fourth Industrial Revolution is going to be launching 9 projects focused on AI and machine learning, precision medicine, the Internet of Things, digital trade and cross-border data flows, innovation in production, autonomous vehicles, civilian use of drones, blockchain, and environment and oceans. And as an international organization that convenes governments, companies, non-NGOs or not-for-profit organizations, and the public in general, the World Economic Forum is well positioned to help create an infrastructure to answer the very important questions of how can all of these new technologies and how can all of these new possibilities that are at our fingertips because of the fourth industrial revolution really help humanity and not create more health disparities or disparities in the way people live their lives, but really lift everyone up. And I think this is a real concern. Down in the bottom, you'll see the white building, which for those of you who have lived here for a while and know the history of all the technology will recognize that as a very historic landmark. And that's really the center, that will be the center for the fourth industrial revolution. This center is being sponsored by great organizations, in addition to the World Economic Forum, like Salesforce, Kaiser Permanente, Microsoft. And I'm really proud to announce today, for the first time publicly, that the American Heart Association will also be a sponsor of the Center for the Fourth Industrial Revolution. And the AHA will be bringing its resources, its volunteers, its scientists, its business resources to bear to help focus on the issues around precision medicine in the Center for the Fourth Industrial Revolution. We're very excited about that opportunity and look forward, hopefully, to engaging some of you in that work as well. The last thing I want to talk about is the importance of giving people trust and hope. And I'll come back to Finn. Now, the day I met Finn, he had this awesome shirt on. It says "Future CEO," and so I was a little nervous. I said, "You know, Finn, I'll keep the seat warm for you. Don't worry." But you know, this young child, Finn, and his mother, Brittany, most especially, have aspirations for his life. You know, they want to see Finn rise and become a productive member of society. But there are so many questions about how new advances in science, new advances in healthcare treatment, and how new ways of using and collecting data for precision medicine can help young people just like Flynn. And so I invite all of us as we do our work every single day to lift up our minds and remember that there are people who are counting on us to find solutions and to bring new solutions to bear. So with that, I will say thank you very much, and I think Bob Harrington and I are going to have a little conversation. Thank you.
I'll just sit here. Thank you, Nancy. Terrific. And we'll let people start to get to the microphones. As they're doing that, let me just open up with a few comments and questions. The first is that for people that aren't familiar with the AHA, from a research perspective, they might think, well, this is an organization that's traditionally worked with pharma and biopharmaceutical companies. and device companies, and now it's much different.
Yeah.
I mean, your partners now are all the tech companies.
Absolutely.
How has that transition taken place, and what do you see for the future of AHA in terms of grant funding, donations, et cetera, that really fit with a changing paradigm?
Yeah, it's such an important question. And just to give you a sense of the magnitude of the AHA's existing research program, right now we have about 2,200 active grants that we're managing, several hundreds of millions of dollars of research funds at the AHA. And largely, in a historical perspective, money has come into us through fundraising. For those of you who help us raise money, thank you very much. And through a very aggressive peer review system, we've granted it out. But now we're into this business of strategic business relationships, where we are working much more closely with pharmaceutical companies and technology companies to bring the best of what each of us have to offer to create new opportunities and new solutions. And so we're doing that in, I'll use quotes, in almost a joint venture way in a number of ways. Our work with Amazon is a great example of that. We've jointly created the precision medicine platform. We're jointly giving out research grants. We're jointly bringing to bear a number of assets that we have now and will continue to explore in the future. We're doing the same with Verily and AstraZeneca. And I think that's going to be an important model for the AHA's future, both with businesses will invest in directly, as well as opportunities for people to access funding from the AHA.
So there's a lot of young investigators in the audience and have been for the last couple of days. One of the things they want to know is, well, how can I gain access to some of this data? Yeah. Now, some of it you specifically noted is designated through research funding, et cetera. What if people have their own research funding? Can they come to the AHA because they want to collaborate over an interesting question and gain access to some data?
Absolutely. That's the reason we've built the data discovery platform, is that we want any accredited investigator to be able to use this data to push forward questions. So the reason we're giving money initially is to build momentum for the system. But over time, we hope that the system will be the momentum itself, and people should come forward now if they have interesting questions and are interested in accessing data.
To continue on the research funding theme, one of the interesting things, Kellen McRae was here yesterday, as you alluded to, and talked about One Brave Idea. Yeah. You talked about the Amazon relationship with AWS. There's also been the network grants. This is a really different type of research grant.
Yes.
Suggestions, recommendations, thoughts for the audience, particularly, again, the focus on the young investigators, how they should be thinking about, in this new era, how do they get prepared to work with groups like the AHA?
Yeah. We're thinking a lot about this question because we have built the legacy of the AHA's research program on providing funding to young investigators. And we're so proud of the people who are established today that started their research career because of the American Heart Association's funding. So we intend to try to figure how we can create fellowships to work with some of these programs. But I think this issue of mentoring is very important. I know that the senior people who are leading a number of these enterprises are very interested in serving as mentors for young folks who are interested in knowing and understanding this convergence of specialties that are working in some of these new areas.
Talk a little bit about specifically the network grants, that which are different than some of the other things you've talked about.
Sure.
Because they do fit with the theme of big data, because they're really everything from discovery to pop health. They're one institution, but required to partner with other institutions. Yeah. Give the group some sense of the kind of things the Heart Association is doing in that arena.
Yeah, we recognized a number of years ago that if we were going to meet our own goals at the AHA, we needed to be very precise about areas of research where we saw big gaps and where we felt that if we were to fund centers of excellence and provide a lot of money to a center of excellence, that we could get quicker outcomes to areas that were important. So over the past 4 or 5 years, we've launched centers of excellence in women and heart disease, prevention, health disparities, heart failure, and soon we will be announcing centers in atrial fibrillation, children's health. Actually, those just went through peer review, so the winners will be coming out soon in children's health, and peripheral vascular disease. These centers, we invest between 15 and 20 million in each network, and within the network, 3 to 4 to 5 centers are selected selected to do the work in that particular topic area. So, for example, in health disparities, we have 4 centers of excellence in health disparities. Each center has a center director and 4 or 5 senior and several junior people that are working, and then across each of the centers that make up a network, we require collaboration. This has been an amazing movement in the AHA's research program. We have seen so many people learn and grow. We have also seen sharing in institutions that wasn't happening before, let alone across institutions, of data, of samples, of ideas, of training of young people. It's been really remarkable.
I think there's a question up here.
Thanks, Nancy. I'm William Gunn from Elsevier, and
Hi.
it was a really impressive, visionary presentation. I liked it very much. I was thinking, though, given that a gentleman just earlier this morning talked about the leaky pipeline of drug discovery, and a lot of the problems they've had with that coming from irreproducibility of the preclinical results. Could you talk a little bit more about what you're doing with your grant program to ensure that not only that the research gets done, but it's really as rigorous and reliable as it can be?
Yeah, thank you for that question. We have the highest standards at the American Heart Association for our research programs, both when we're deciding who to give money to and after we've decided who to give money to. And so in many of these programs, whether it's our Institute for Precision Medicine or our traditional granting mechanisms, we have oversight groups that are charged with managing the activity that's going on. So, for an example, the networks that I just mentioned, let's take the heart failure network. Those 4 centers of excellence are managed, if you will, by an oversight advisory group of AHA volunteers, 10 or so science leaders who stay very focused on the research production, the data, the publications, the sharing, and where appropriate reproducibility and other kinds of things. And so we take our role in pushing that pristine quality very seriously.
Thank you.
Thank you.
I thought you were going to ask a question from Elsevier about.
I was going to say about the journals.
About the future of medical journals,
yes,
or the dissemination of information.
Yes, exactly.
That will be another discussion.
Okay, there you go. We're happy to talk about that too.
Over on this side.
Yeah. Nancy, great talk. My name is John Birch. I'm with the Mid-America Angel Capital Network in Kansas City. I have a question for you about FIN.
Yes.
Number one, if you wouldn't mind, how many FINs are there approximately, and what can be done to provide them with lifelong access to their data?
Yeah. I would hate to misquote the number. Do you know the number of how many kids are living with congenital heart disease?
I do know that the fact that there are now more adults living with congenital heart disease than there are children. Ewan, do you know the number of children with congenital heart disease? Would you mind looking?
Go on the American Heart Association statistical update. That number will be very handy. We publish all the statistics every year in our journal circulation. But there, as Bob has said, more kids, because of advances in medical treatment and surgical procedures, more kids with congenital heart disease are growing up to become adults, which, by the way, and off to the side, not your question, has created a real challenge for adult cardiologists who are managing, kids who've grown up with congenital heart disease, and that's been an important area for training and for new, medical practice. But in terms of the data, I can tell you we have a council on children and cardiovascular disease, and we work very actively with our own families of kids that have congenital heart disease. For example, Finn himself has 43,000 followers on Facebook. If you went on Finn's Facebook page right now today, you would see that he's doing a Dance with Finn competition to raise money for the AHA, kind of like the Ice Bucket Challenge, and all these people are doing it. But what they want is they want to know, what should they be tracking? So Brittany, Finn's mother, what should I be tracking? What should I be using? Does the doctor want to see it or not? And is there a way to create, and we talked about this earlier, a children's personal medical record that can follow a kid like Quinn through his lifetime, not just with basic information, but really detailed information. Finn, as an example, today, I understand, because he was intubated so many times, when he gets a little cough or something, he has to be hospitalized, and is either on his way to the ER or has been hospitalized for that. Is that important, and what kind of data should be captured? We need a scientific approach approach to figuring that out to help people like Finn and his mother.
Would you be interested in creating a registry, a proactive, prospective, observational registry going forward for these children?
Yeah, there are some registries in the marketplace already, and we at the HA care a lot about registries. We have our own hospital-based registry with 10 million patient encounters around all kinds of areas, and I think we'd be happy to talk about that offline. We are in the registry business, that's for sure. Thank you.
Yeah, and it's a great example of something that both Adrian and Mintu talked about this morning, that here you have a disease or a condition that's relatively infrequent, and yet trying to do clinical trials in that group has proven to be very, very difficult, in part because of that infrequency. So bringing them together in a unified way certainly was one of the goals behind the Children's Heart Network. Ewan, you've got a data source.
Yeah, Ewan.
From the AHA website.
Thank
itself.
you.
So 40,000 new cases every year,
Right.
almost 1 million adults and almost 1 million children living with congenital heart disease.
Thank you.
Thanks, Ewan.
Yeah.
That was good. I'm glad you were sitting there.
Yeah.
Nancy, let me extend the conversation, because you brought up, and we know you have a leadership role in the World Economic Forum. The non-communicable diseases are really, the WHO and others have acknowledged that this is really now the next scourge of the earth.
Yeah.
And if the ischemic heart disease, for example, is now the leading cause of death and disability everywhere except for sub-Saharan Africa.
Right.
What relationships does the AHA have, or what work is the AHA doing with other disease organizations, cancer, kidney disease, diabetes, obesity, et cetera, because they're all the same risk factors that tie them all together: smoking, physical inactivity, poor diet, et cetera.
Yeah, these are real problems that need to be solved, and collaboration and integration of strategies will allow it to happen. I actually just came back from Geneva, where I was at the World Health Assembly, where the health ministers of every developed and developing country, 110 health ministers, including our own Secretary Price, were there, thinking about this issue of non-communicable diseases and what are the strategies that can be focused on together. And in much of the world, there are issues around building infrastructure. You know, when we think about primary care delivery in countries outside of the large developed country, you know, it doesn't exist. And in a way, it's so horrific. But in a way, it's an opportunity, because do we need to build these big buildings and have, you know, all of this infrastructure to be able to deliver primary care in the world so that we can monitor and track things as simple as people's blood pressures? So how can new technologies and companies that are actively working in this space, you know, think about creating technology solutions and dropping them into countries so that people can manage their health better? These are the kinds of things we're involved in terms of thinking about the global health picture. We also recognize that the American Heart Association's own vast network, as I mentioned earlier, we have a presence in 70 countries, largely through our CPR and first aid business, where we not only write the guidelines for CPR and first aid, but we deliver solutions in the U.S. certainly, but in 70 countries where training centers who are certified or other organizations are able to help spread the importance of CPR and first aid and deliver science-based care in those countries. So how do we take those relationships and extend programs that we have, like Get With the Guidelines, or extend other things important to countries like managing blood pressure? You know, I would say from an international point of view, this concept of blood pressure management is really key and very important, and that there's a high level of interest, as well as in diabetes management.
Yeah, let's talk about blood pressure for a bit, because the AHA has been very involved in large data exercises, check it, change it, in terms of trying to maintain blood pressure control at the individual level, but also the community level.
Yeah.
And our friends Alan Go at Kaiser have been superb at this.
Yes.
Lessons learned from those exercises, because in part, that exercise has been a data exercise.
Totally. You know, we did a study with Kaiser probably 7 or 8 years ago that showed that patients who managed blood pressure remotely and uploaded that information in a way that exception reporting could be done by nurse practitioners in doctors' offices, those practices had much lower aggregate blood pressures of patients than practices who didn't do that. So that's old information, yet the practices in this country haven't changed. And so we've, at the HA, have created many technology tools, Heart 360. We've created programs like Check, Change, Control that are community-based programs. And most recently, we formed a partnership with the AMA to develop and launch a program called Target BP, Target Blood Pressure, where we're working with primary care practices throughout America to help make sure that there are technology solutions for tracking blood pressures of patients, where practitioners are setting goals for blood pressure management and will be incentivized and recognized for having blood pressures controlled at certain levels. And that data then, of course, comes in a de-identified way into a data repository so that we can use that for science and research as well. We've seen from other AHA programs like Get With the Guidelines that this benchmarking of data between hospitals has been very valuable in improving the quality of care delivered in America. So if we can do the same with blood pressure management in an office setting, not only will we help people live healthier lives, but we'll have this vast repository of data that can help all of us know and study and understand what will it really take to help people have that shot at good health.
Hypertension, high blood pressure is an area that really brings out some of the challenges in underrepresented populations and vulnerable populations. And one of the new relationships that the HA has is with the Jackson Heart Study.
Yeah.
Again, I know that there are people in the audience who are working on health disparities, who are working on underserved populations. You want to comment on what the HA is doing with Jackson Heart to try to give some people some insight, and also it's a data source that people can access.
Yes, absolutely. We have a strategic relationship with the Jackson Heart Study, which is the largest cohort study of African Americans, Jackson, Mississippi, 3 generations followed meticulously over time, similar to the Framingham Heart Study. And the Jackson Heart Study and in Framingham, the HA has given competitive grants for people to use those data sources together to try to look at this issue of health disparities. And some really amazing findings have come out of some of the early research that we funded. We continue to work with Jackson and hope that their data will become available on our data platform through the Institute for Precision Medicine. And in the meanwhile, folks who are interested in looking at and studying that data, come to the HA because we can help make that happen. The other thing I'll say on health disparities that's so important is that we recognize, study after study after study, whether it's economic impact, whether it's education levels, that these social determinants of health really matter in terms of the promise that people have to live a long and happy life. And we don't believe that zip code should determine a person's health status, but it really does. In many cases, the zip code is a more obvious indicator of a person's overall longevity than their genetic code will be. And so we must find ways, and we must find new strategic partners to help people in communities see this promise for a long and healthy life. This is one of the reasons in the area of blood pressure that we've managed and created a relationship with the YMCA of America. We have determined, as has the YMCA, that if we can use the physical locations of the YMCA and their proven ability to bring people in to focus on health through the diabetes prevention program that has been run through the YMCAs over the past many years, if we can do the same thing in blood pressures, we might really be able to get to the heart of communities where real people with real disadvantage live to help them.
A final closing comment. We have about a minute left. It made me think of it when you said we brought in the economic issues. One of the things the HA has done well through your CEO Roundtable, you've accumulated a number of relationships with big employers.
Yes.
Tie that in as we finish, because certainly the big employees who are bearing a lot of the cost of healthcare are very interested in what the Heart Association is doing.
Yes. We created a roundtable of CEOs led by Henry Kravis, the co-founder of KKR, and Terry Lundgren of Macy's. We have now 30 CEOs of large influential companies, Bank of America, Nestle, UPS, AT&T, Kaiser Permanente, Johnson & Johnson, Merck, et cetera. You get the idea. This roundtable has agreed to be an incubator for new ideas for creating solutions for employees and employers to help people be inspired to manage their own health, and for employers to have new ways to think about engaging people in their health so that they see the company as a great place to work, but also in a way to control healthcare costs. And we're very, very pleased with what's come out of this. One of this, at the core of it, is a data question. We're recognizing companies both on subjective as well as very specific health data to recognize companies at gold, silver, and bronze levels in a way to try to move companies up to offer more things for employees. And the data that we're seeing from that is really remarkable. And so over time, again, in a de-identified way, we hope this data can be available.
Great. Well, join me in thanking Nancy for joining us here on campus.
Thank you.
Thank you, Nancy.
Thank you.